Hello, Dr. Marashi, and welcome to Age Better.
I'm happy to be here, and thanks for the invitation.
Of course, and I made sure, knowing that we were also going to be seeing each other, that I took very good care of my teeth today. I did a nice little flossing, a really good brushing, made sure I looked really great for you today. So thank you for encouraging all of us to take good care of our teeth. So I have gotten so many requests from listeners over the last 3 years to do an episode on cosmetic dentistry and oral health and its connection to our overall health. So this is a long time coming. And of course, I waited for the best possible expert to join me. So thank you for joining me today. You know, it's really fascinating because I think a lot of us still separate our oral health with our overall physical health. But I know, and I think you absolutely know, that there are so many studies that show that there's a very deep connection between the oral health and our physical health, our body health, and especially as it relates to our heart health. So can you talk us through a little bit about what that connection is?
Absolutely. The Surgeon General actually put out information when I was in dental school talking about the link between oral health and systemic health and heart health. What I would say is that the information didn't make the rounds as well as it could have, because now it is a hot topic and better late than never. But the reason why I mention it is because it's to share with the listeners that this is not something that someone woke up one day and said, oh, here it is. We've actually known about this for a while. Just as a society, I think that there is an increased awareness and desire from people to want to take better care of themselves. The mouth is the gateway to the body. It's undisputable, and everything goes in, and not just your food, but there's also sustenance, like water and the air that we breathe. So
Right.
Everything is going through here, and there's going to be a compounding effect on the rest of the body. We used to just think that the worst thing that could happen is you would either rot your teeth or get a stomach ache. And now we know that it's far much more. The bacteria that are in the mouth have actually been shown to be present in plaques in the brain of people that have Alzheimer's. I mean, how crazy is that?
That's crazy. And scary.
Yeah. It is, because, if you think about the evolution of humans as a species, we live a lot longer, than what our ancestors did. So if you go to a time where humans made it to 30, 40 years old, you weren't alive long enough for your teeth and your oral health to get bad enough to have these long-term problems, but now people can live very healthy, past 80 years old, and it'll catch up with you. So we now know that with those bacteria in the mouth, it can actually get into the brain. But a lot of that revolves around our diets, plain and simple, because the Western diet, which is very carbohydrate rich, well, guess what carbs do? They stick to teeth.
Yeah.
And when you have things that
Like
stick
sugar
to teeth, exactly, bacteria have a breeding ground, and then they start using that as a food source, secreting acids, multiplying, getting into the bloodstream, and they circulate and they start wreaking havoc. And it's not even just Alzheimer's. There's evidence that in addition to the heart, there's also with like blood pressure, but also diabetes is a factor as well. So. Yeah, it's multifactorial.
It really is. So you mentioned diet. So what kind of a diet do you recommend that people really focus on more to help their oral health, which will then, of course, help their body health?
So this brings up two interesting points. So, every dentist is supposed to say, don't eat too much sugar, and don't eat this and don't eat that. And what we now know is that, a lot of the things that we eat, aside from your teeth, there's a million other reasons to not eat it, just because of the harmful effects on the body and the effect on aging and so forth.
Yes.
So what I would actually lead off with say, look, regardless of what you're eating, if you are able to manage the hygiene in your mouth, where you're keeping it clean, and this stuff doesn't have a chance to create adhesions on the teeth and colonize and spread, then you're going to be fine.
Okay.
So I lead with the dental hygiene conversation first. And yes, the diet is a secondary component, but even if you have a cleaner diet, but your oral hygiene is terrible, you're still going to run into problems.
Right. Right. It just went when I first started reading these studies, and in fact, I actually had a section in my first book, which came out in 2010,
Okay.
about this connection. I mean, that's how far back these studies go. So your point earlier on is so true that the messaging just wasn't there in getting the word out. I mean, we tried, you've been trying in your own way. I tried in my own little way through this little section in the book. It wasn't a big section, it was a little one. And clearly, I don't think it got out, which is so crazy. And it just blew my mind about the connection. Specifically, what I wrote about was the connection to cardiovascular disease. The bacteria literally going into your gums and working their way into your bloodstream. If you think about it that way, it's like, no, like that's a great motivation to start taking better care of your teeth. But I want to get over to something that is kind of fun and funny at the same time. It's dental trends that I've seen blowing up on social media, like on TikTok and Instagram and the like. And by the way, you have a great Instagram presence. And I really want everyone to follow you because you also give great tips, but you're very entertaining. And so I will have that in the show notes, everyone, so you can start to follow Dr. Marashi. But some of these trends that we're seeing, we want your opinion on them. Like, should we do them? Should we try them? Or should we just keep scrolling? For example, like oil pulling, tongue scraping, which of course I think we've heard about for many, many, many years. But take us through some of those. Anything that we should really focus on?
Yeah. So oil pulling has, it kind of comes and goes in waves with its popularity.
Yes.
And there actually has been research done on oil pulling. And I want to give a disclaimer. I have not read every piece of literature out there on oil pulling, but the stuff that I have seen says there is evidence of it being helpful. There's zero evidence of it being harmful. Where the question lies is, how effective is it really? So for my clients that have asked me, hey, what do you think about oil pulling? I'll tell them, say, look, if you want to do it, there's zero downside for it. And if you get a benefit for it, fantastic. So I have no issues with oil pulling at all. With tongue scraping, I'm a huge fan of that. And I'll tell you why. Because I drink coffee. And by the way, I think any dentist that says don't drink coffee because it stains your teeth, I mean, look, it is called life.
Yes, exactly. It's called life. Yeah.
But black coffee, will leave residue on your tongue. And what happens is that it gets into your taste buds. These are the papillas on your tongue, and it will work its way in between. Your tongue is like a shag carpet. People don't realize that. And so stuff gets in there, and if you stick your tongue out, you'll see like a brown whitish layer. Usually it's heavier towards the back than the front. And that stuff can ferment, and it creates bad breath, and it dries you out, and bacteria can harbor in there. The tongue scraper that I like the best is this one that's made out of copper. So it's a lot more hygienic, and it just feels like it's got a little more oomph. It's like putting a metal rake across your tongue, and it just really does a good job taking it out. I've tried the plastic ones, and I mean, they're better than nothing. I don't think they are quite as effective, but tongue scraping, I think, is a really positive thing for oral health.
Yeah, that's good to know. An episode that just came out last week, actually, was a conversation I had with a very famous, she's written a lot of books about yoga and the whole yogi lifestyle. And one of the things I said, kind of take me through a day in the life of a yogi like yourself. And she started with that, like, wake up, you have a lot of, doing little meditation, and of course, but then you drink a lot of water and then scrape your tongue. So like it's very much a part of the healthy lifestyle of a yogi. So I found that very, very interesting. But yes.
Wow. Okay.
Yeah.
I didn't know that, but you learned something new.
Learn something new. I learned that too, I listen to Dr. Andrew Huberman, the Huberman Lab, often. I mean, he goes on and on, but still like him. And one thing that he says to do in the morning, of course, getting the sunlight first thing, but also to take water and then swish it around your mouth really, really, very aggressively. So it's kind of a form of tongue scraping, but not quite as effective, I would think. But I do that.
The lavage is the best way to think of it, because most people, when they wake up in the morning, so at nighttime, when your head's back on the pillow and you're sleeping, you have decreased salivary production. And why is that? It's because your mouth isn't moving. Movement is of your tongue, your cheeks, your lips. That's what stimulates saliva production, and on top of, when food hits it, that also causes secretions too. So saliva is the least active at nighttime. And that's why it's so critical that when you go to bed, like if you're if you're going to cherry pick when you're going to brush and floss, nighttime is the time you want to do it because you want to debride your mouth of all the crud that's stuck on there. So when the mouth is least active, because remember, in your saliva, saliva has two functions, by the way. Number one, help you swallow your food so you don't choke on it. And number two, it's to bathe and rinse off the surfaces in your mouth, your teeth and your gums, etc. So when you have the least amount of saliva production, the bacteria can be more effective at doing their harmful job. Saliva also contains enzymes that neutralize the bacteria that are harmful in your mouth. So less saliva production, guess what? More opportunities for bacteria to do things. So I tell people, look, you're going to pick and choose, do it at nighttime because that's where the most damage is going to occur. I mean, I'll tell you a funny story. I get more patients, just a small handful, because, times have changed over time, where they're like, but doc, I really like having a chocolate on my pillow at nighttime. It just makes me feel good. And I'm like, well, okay, have it, but you got to brush. I know, but I really like doing it after I brush. I'm like, look, I don't practice magic, okay? And no matter how many times you ask me this question, I'm not going to tell you what you want to hear. You're doing things that are harmful. And if you don't care, then, you're an adult. That's your decision, and you're going to have to suffer the consequences that come with it. But
yeah, that makes so much sense, though, after a full day of, living and eating and breathing and everything else that we do and drinking, and to do that at night and really do all of your practices at night before you go to bed. I mean, of course, I brush my teeth before I go to bed, but didn't really think about the flossing and then all the other stuff that I could be doing. I also want to ask your opinion on something else I heard about recently somewhere on social media about how people are now, when they brush their teeth, they're not rinsing with water so that the toothpaste with the fluoride actually stays on your teeth. Good or bad?
Yeah, there is zero downside for that. And for those
except
who
you have a taste of
well, yeah, I mean, you got the
coating.
residue in your mouth, but so I'll give you an example. When someone has had their teeth cleaned professionally in the office,
yes,
and we advise for them to have a fluoride treatment, all that is, it's a little tiny little medicine cup with some fluoride rinse in it, and they swish for like a minute.
Yes.
And we tell them, don't drink any water for 20 minutes. And the reason for that is for that fluoride to actually get some absorption into the teeth to help mineralize it. So this is actually something interesting. And if I'm hijacking the conversation, you tell me, because this is actually relatively new information in dentistry. Cavities, depending on the size, have the ability to reverse themselves depending on the pH of the mouth, because your tooth enamel is a crystalline structure. And what causes it to break down and get a cavity is a change in the pH. It has to go to a highly acidic environment or to a low pH. When enamel starts to break down, it's not a giant hole right out of the gate. It's just a demineralized area. And if it hasn't penetrated all the way through the enamel, if the mouth goes from a state of acidity going to basic, so the opposite side of the pH scale, the enamel can actually remineralize. But once it's broken through the tooth enamel into the dent, now you're out of luck. You got to get a filling. There's no way to treat that at that point.
Wow.
So we now know that, like, people who drink lemon water all day, double thumbs down, because all you're doing is keeping your mouth in a chronic state of acidity, which lowers the pH. It thins out your teeth enamel because you're spreading it everywhere, which will make your teeth more sensitive, probably make them more yellow, but also increases the likelihood of you getting cavities. So the pH is a big thing. You mentioned Huberman earlier. He had a podcast on kind of a real deep dive into the science, the hardcore science of oral health and its connectivity to the rest of the body. So, so for the people who really want to geek
Take
out
that
on some of the heavier,
deep dive,
deep dive. Yeah,
2
it was a
hours.
really good one. Yeah, I think it was
2
3
hours.
actually.
3 hours.
Yeah, but it was done very well, and they had some incredible researchers and experts, drawing up, heavier scientific insight into this.
Thank you for that. I didn't catch that, and I will look for it, and then there will be a link to that, everyone, if you want to take that deeper dive in, which I think I'll want to, because I find this all very fascinating. I start to become a nerd. Like when I get obsessed with something, it's like right now I'm obsessed with what we're talking about. So I may very well take that deep dive. So let's talk about something that, I've seen you write about and talk about a great deal over the years, and that is that how your lower part of your face, meaning here, your mouth, and everything in it can really start to indicate how you're aging. I mean, let's talk about, aging, how
Yeah.
your mouth looks, how your mouth is, the health of your mouth, the look of your mouth, and aging. Let's talk
There's
about that.
so much to unpack here, and it's an
Yeah.
incredible conversation. So,
Yeah.
okay. So I'm going to start with something really high level. If you take someone who's like 18 years old with beautiful, healthy mouth and teeth, and imagine you pulled out all their teeth and stuck dentures in their mouth, and then you pull the dentures out, what would happen to their face? The whole lower third of the face. So I'm talking about the distance between your nose and your chin. It collapses completely. The nose and the chin get closer together, and the support around the lips smushes inwards. And just think of what an old person looks like without
Yes.
teeth.
Yes.
Because the teeth and the bone that hold the teeth are what support the entire lower 1/3 of the face. So as we go through the aging process, if you lose teeth, if you lose bone, you have the ability to start collapsing the lower third facial height. And when the facial height collapses, it makes you look older. When the facial height collapses, what happens to the skin? It mushes together and it gets wrinkly and crinkled. So you don't have to necessarily lose all of your teeth. I'm just trying to paint a really visual example that I think a lot of people can relate to.
Yes.
But take someone who hasn't taken care of their teeth, okay? So we know that over time, teeth can actually become shorter in length due to teeth grinding, teeth clenching, poor oral care, just the aging process. So if your teeth are getting smaller in size collectively, the distance between your nose and chin can get closer together because everything is shrinking. Number two, we know that when you show less teeth, that also aesthetically or visually translates to an aged appearance. So you may not have lost any, like a whole tooth, but you could actually be 25 years old and look like you're much older because your teeth have advanced signs of aging compared to what is age appropriate. So when folks come to see me and they say, hey, I want to improve my smile, some of them are coming because they have damage on their teeth.
Right.
Some of them are coming purely driven by aesthetics. Sometimes it's a combination of both. But what we find is that when we put the length and the size and the shape and especially the color back into a tooth, you're rejuvenating the entire lower 1/3 of your face. You're restoring the facial height, you're restoring lip support, and the amount of tooth that shows below the lip. Once
The amount
again,
of tooth that shows below the lip. And also
below
what's
the top
interesting
lip.
is that very often as people get older, I guess it's just gravity really
Yeah,
does take
goes
over.
this way.
And
Upper
so
lip gets
you
longer.
see less upper and
Yeah.
more of the lower.
It's a candle
right?
burning at both ends because the teeth are getting shorter and the skin between the bottom of your nose and the top of your lip, you lose the elasticity of the collagen and it gets longer. So you show less. So simply by just giving a little bit of length back for the teeth, you can actually help restore that beauty and that youthfulness.
So talk to us about what are the procedures that can help that.
Okay.
What do you normally recommend?
In my practice, what people are coming to me for predominantly are for porcelain laminate veneers. And porcelain veneers, for those who may not know, it's a little sliver of porcelain that's bonded directly onto the front of the tooth. Think of it as almost like getting your nails done. And we can control the shape, the size, and the color. And if you do multiple, meaning the visible range of your smile, which is kind of from corner to corner. So most folks will do 8 or 10 teeth on the top, maybe a matching set on the bottom. And now you have the ability to control the overall architecture and support as well as the aesthetics of the teeth. So that's the most common thing that I'm doing every day.
Right.
Is it the only way? Absolutely not. Sometimes it's actually on the other side of the spectrum is orthodontics. And there's some type of, whether it's braces or Invisalign, which is taking teeth that were in the wrong place because they had a crooked smile and moving them into the right place. That gives them the lip support, the facial support, the visibility of the teeth, and they may supplement it with teeth whitening. And so, not every candidate needs to have a mouthful of porcelain veneers. Sometimes it's ortho, sometimes it's Invisalign, Sometimes it's just teeth whitening. There are other cosmetic procedures, like bonding that sometimes gets done as well. And, how I decide what's appropriate for the patient is you have to look at what their starting point is,
Yes.
and then figure out what's their outcome, because everyone's got a different vision of beauty and where it is they're trying to go. And
Right.
that's how you can reverse engineer to figure out what the best solution is going to be.
Right. And just tell us about veneers. How long do they usually last? Like, what's
Yeah.
the typical?
It's a great question. So if you go on the University of Google, you'll probably see somewhere around 10 years. But the reality is that this stuff's lasting way longer than people ever thought. I have 10 veneers on my own top teeth, and I'm going on year 23 right now. And what we now know all these years later is that the materials have gotten better. They've gotten stronger. The techniques for adhering them to the teeth have gotten better. So the jury's still out. In my
On how
practice,
long they last.
Yeah. I mean, because we don't even know with these newer generations. Maybe they go a lifetime. What I tell folks who come in to see me, I say, look, let's say I treat people of all different age groups, but let's just say you're 40 years old and you're doing this. Well, let's say you go to 100. It's not unreasonable to say you're probably going to change these out once more during your lifetime.
Yeah.
But the process has been evolving radically from even when I started doing this. Like now we're using digital scanning technology instead of these goopy molds, and 3D milling is starting to become a thing. It's not quite as artistic as handmade veneers, which is why I do handmade veneers instead. They're just more lifelike and more beautiful. But make no mistake, it will get there. And it will get to the point later down the road where instead of it being, more of a lengthy and expensive process, people could go in same day, get it done, just as well as what we do now. So that's kind of exciting to think about because it opens up access to care because more people can get it done because the cost goes down. And it's an easier procedure to go through as well. So, yeah, I think 15, 20 years, there's nothing unreasonable.
Is a good, that's not unreasonable.
When it's been done properly,
Right.
ultimately.
I have to share with you,
Yeah.
back, I was born with a genetic missing teeth.
Okay.
And so, especially on one side, and so, I have to go back in time. And back then, when I was a kid, they only put braces on and they tried to kind of reposition my teeth instead of putting something in to replace the missing tooth on top. Got that? So my whole center of my smile was off.
Oh, yeah.
My whole life. So when I became a young adult in the world working, I decided my dentist, who was just a regular dentist, was trying veneer. This is back in the very early 90s. Late 80s. And I actually got veneers. And they lasted all this time. The 80s. She was a pioneer and I was a guinea pig. And they were great. It was one of the best things I ever did for myself. Truly.
Well, that's a testament.
I cannot say that enough. It is truly one of the best things I ever did for myself. And then finally, about, I want to say about 8 years ago, I lost track, that one of them started to chip a tiny bit, unnoticeable, but I noticed, and so I had them redone.
Okay.
But
so you had
look at how long
run.
they lasted.
Yeah.
And that was like the first
in the
kind of go around.
Yeah,
the
it's
early
really
version.
a testament to dental work being done properly and carefully.
Yes.
And with care. Because I'll see what I like to call super senior citizens in my practice, and they have dental work done like literally in the 1950s and 60s where the materials were not that great, and it's holding up just as good as the day it was done. And then I get people coming in who just had veneers done somewhere else, and it was a disaster.
Yeah.
And I'm the fix-it guy.
And you're the fix-it guy, a good fix-it guy. Yeah. So let's kind of make this super practical for everyone listening in. Boil it down to a few must-do things everyone should do to really maintain the health and the look, if possible, of their teeth as they get older. I mean, sure, they should, if they want to kind of fix that lower third of their face, as we were just talking about with veneers or bonding, whatever it is that they should have, great. But what should they be doing on a daily basis to really maintain that oral health?
Yeah, well, you said the key word right there, maintain, because the answer to your question is maintenance, and it's not a sexy recipe. But neither is maintaining everything if you want it to last a long time. It requires consistency and discipline, and it's not a secret formula. Brushing your teeth, flossing your teeth, being mindful of your diet. These are the non-negotiables.
Right.
And
scraping your tongue.
Yeah, scraping your tongue.
New thing.
Definitely like that one. But
Yeah.
also, if you want to have longevity, because no matter how good you will do on your own, most people do not have the manual dexterity to get every nook and cranny.
Right.
And that's where you get the buildup, and why when you go into the hygienist, half the time it's hammer and chisel getting this crud out. So that's why I have advocated, say, hey, look, don't wait till it's hammer and chisel to get out. What if, okay, here's a thought-provoking question. What if every time you went to the hygienist, it was maintenance as opposed to hammer and chisel? Is that you're in a state of perpetual cleanliness? How do you think that would impact the overall level and quality of your oral health? It'd be fantastic. And even from a dollars and cents perspective, a couple more teeth cleanings a year is way cheaper than me having to do a procedure on you.
Yes.
So I'm a huge proponent of, keeping your house clean all the time and having the cleaning people team all the time, as opposed to letting it become a disaster and then cleaning it up.
Yeah, I'm with you on that. I like the idea of maintenance and taking care of every part of my body where I can. And my house. Well, this was great. Before I let you go, back to your patients, you're very lucky patients, I must say. Do you have 3 takeaways you want to make sure everybody remembers from this conversation today?
Yes. Okay. Number 1 is just what we talked about the importance of maintenance overall. And, whatever your motivator is for it, it could be the health and the longevity of your oral health and your teeth. It might just be vanity driven. Doesn't really matter. Just do it, because you're going to get the benefit of both. That's number 1. Number 2, just know that with contemporary dentistry, if you want to look better and feel better and have it done really conservatively, there are treatment options out there that can help improve this situation for you. So talk to your dentist, find out what their level of experience is with it, and you might be surprised what the possibilities are. I think that's really cool.
Mm-hmm.
3, goes without saying, keep in mind that this is the gateway to your body. And if you're serious about your overall health, it's going to start with your oral health.
Thank you so much. I wish you were a little closer to New York City, Dr. Marashi.
You know how many people hop on the plane and fly out?
I believe it.
I've been very blessed to have folks from all over the world. So you have an open invitation.
Thank you so much for joining me today.
Absolutely my pleasure. Thanks for having me on.
Talk to you soon.